Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. Prescriptions are on the rise across all age groups, no more so than in the over 65s. And I want to share with you in this video some very important questions to ask if you are over the age of 65 before you take any prescription medication. The statistics are absolutely staggering on prescription medications in over 65s. 90% take at least one prescription medication, 80% take at least two, and almost 40% take 5 or more prescription pills. And as a hospital doctor, I can't tell you the number of times I see an older person. I'm going to have the cutoff of age 65 or over for this particular video, but I can't tell you the number of times I see an older person admitted to hospital as a direct result of a side effect or adverse event to a prescription medication. And that's why I want to share this with you here. And the fact is that as one gets older, the body becomes more sensitive to medications. Somebody who is 65 is going to be more sensitive than a 25-year-old. That is simply a biological fact. Here we go then. 5 questions to ask. Number 1, will this medication make me drowsy? An unbelievable number of people over the age of 65 are walking around completely zonked out, what I call zombified, because of their medications, which should be prescribed with caution. Whether we're talking about a medication for pain, a medication for neuropathy, nerve pain, like gabapentin, Neurontin, I've talked about that before, or even other medications with anticholinergic side effects, drowsiness is a very, very common side effect, and you want to be very careful indeed, especially over the age of 65, where other factors can come into play, like cognitive impairment at baseline or an increased risk of more cognitive impairment with medications that induce drowsiness. Number 2, how will this medication affect my blood pressure and pulse? This is especially important if the medication is being prescribed for a cardiovascular issue. Now, obviously, if it's a blood pressure medication, for instance, the idea is that it will lower your blood pressure. But you want to be careful with any number of medications which affect blood pressure and pulse, usually decreasing the blood pressure, but certain medications can increase blood pressure, like steroids, for instance. And lots of medications out there will decrease the heart rate, which can contribute to lethargy, tiredness, or even passing out. It happens all the time. Number 3, will this medication cause electrolyte deficiencies, specifically sodium, potassium, or magnesium? This is another phenomenon that we see all the time, and it's especially important when prescribing certain medications, including diuretic medications like furosemide, or certain blood pressure medications, including thiazide diuretics. Specifically, I'm thinking about hydrochlorothiazide. I'm really not a fan of hydrochlorothiazide in people over the age of 65, actually at any age, but especially over the age of 65. I see a lot of issues with electrolyte deficiencies, especially low potassium, hypokalemia. So please ask before a medication is prescribed, will this affect my electrolytes, and do I need to take any additional supplementation or take any additional precautions? Number 4, how will this medication interact with any medications or supplements I take? This is a common question which is completely missed. Hopefully your doctor is good and will be all over this. Now, lots of older people take supplements, and I actually think that's a great idea. There are some fantastic supplements out there that really help with aging, and I'll talk about that in a future video. But needless to say, if you take other medications or supplements before you are prescribed a pill, please check whether that new prescription will interact with any of your current medications. This question is often completely forgotten about. Number 5, this question is highly doctor dependent. Hopefully you will have a good doctor who will answer this question completely. But these unique questions I would like you to ask. What side effects have you seen, doctor, the most with this particular prescription? What time of day do most of your patients take this medication? And can you tell me if there are any alternatives to this medication in your opinion? Obviously, those answers are completely doctor dependent, and hopefully you will get very honest and transparent answers. There are so many prescription drugs which are being completely flooded onto the market right now, and doctors are learning new things every single week about unique side effects and adverse events. So there you are, 5 questions that are extremely important to ask. Hopefully you're already doing or have done some of those, but people can get very sensitive to medications with each passing year. So this is particularly important for anyone over the age of 65, whether you are or a family member is. Please pass this message on to them. Thanks everyone for watching. Let me know your thoughts down below. Do you have experience with any of those questions? Have you been receiving inadequate answers? Let me know down below. Check out my free newsletters and also my upcoming coaching session on magnificent aging for people over the age of 65. Details down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.